Hi, my name's Dr. Edwin Lee. I'm actually at the Bellagio Hotel at the 19th AMMG meeting, the Age Management Medical Conference. And I'm here today with Dr. Jeffrey Leake, who actually is a recipient of the Mintz Award. So congratulations.
Thank you.
So can you tell us a little about your medical background and how you got to where you're at today?
I was trained at Ohio State University, a bachelor's degree in molecular genetics. Went on to graduate school where I was in a PhD program studying physiological chemistry. I taught first year biochemistry to medical students. I then went to medical school at Ohio State, completed my residency in anesthesiology, spent 27 years in private practice up in the Pacific Northwest. I originally got into age management medicine as a patient. I came down to Cenegenics Elite Health as a patient. I got interested in training, went through their training course, and then decided to retire from anesthesia and begin my practice in age management medicine.
So where's your current practice right now?
I practice here in Las Vegas at the main clinic, and I follow approximately 300 patients in our wellness practice. And I'm also director of education for Cenegenics Elite Health, and I teach our training course, and I train probably over about 800 physicians from around the country and around the world over the last several years in age management protocols.
Fantastic. So apparently there's two types of programs for education. There's one with, if you want to be Cenegenics trained, and then there's the one before that. Can you tell me a little about that program?
Sure. That's the a joint effort from the Cenegenics Research and Education Foundation and the Age Management Medical Group. And it's a 4-day clinical course, quite intensive, where we go over a lot of basic science. We try to be very research-oriented. We have a full day on exercise, a full day on nutrition, and then we spend a day and a half talking about the major hormones, and then a final half day of case studies where we try to bring it all together in a clinical context.
And generally, how many, let's say, people sign up for those classes?
Well, I like to keep the classes small, so ideally I would like no more than maybe 10 physicians at a time. Sometimes we have up to 14, but I like the small group didactic approach. It gives time for me to give individual attention to the physician's questions, and we get an opportunity to have that didactic interaction, which I think is very important.
So can any physician or healthcare provider take this class?
Yes, it would be open to anybody who would be interested in learning more about age management medicine. We start with a series of 9 online modules that the physicians complete before they come in to sort of give them a background, and then the 4 days is quite intensive, and it's a bit of a grind. It's like being back in medical school, but we try to really set a solid foundation which they can go to build on. Because if we do a good job of setting that foundation, then with time the rest can come.
Fantastic. So is it open to nurse practitioners or just only for physicians?
Right now it's only open to physicians. I would actually like to see us open up to some of the allied health professionals. That would be my desire, and perhaps we might move in that direction.
So you have to do the online class first before you go to
yes,
training?
Well, we encourage them to complete all modules. That way that they have a little bit of background coming in, because we get a varying level of expertise. Some doctors have done some age management medicine. Sometimes we get gynecologists or urologists that have done some HRT in their practice. But that sort of gives them a little bit of an introduction and then allows us to go in a much more detailed and sophisticated approach during the 4 days.
And how often do you have the classes?
Our classes run generally at least once a month throughout the year. Sometimes we have 2.
Fantastic. And Johnny, how much does it cost to attend the classes?
The week training is $16,000. After the 4 days of clinical training, one of our vice presidents of practice development come in and talk for a couple days about the business aspect of starting an age management medicine practice, because that's important for anybody who wants to be successful. You do have to understand how this type of practice works, and so we try to give them some insight on how to make that best work.
So tell me a little about your book. Apparently you wrote
yes,
a textbook.
I authored a textbook of age management medicine. It's called that. It's a 2-volume book. Volume 1 we spend on nutrition and exercise. Volume 2 we do hormone management. Start out with a thyroid chapter. HRT for men, HRT for women. It has over 3,600 literature citations. The bibliography is 100 pages long. And it really could serve as a textbook of our course. It's a little more in detail, but it follows the format of the course and sort of our concepts of what we think is a good way to practice.
So where can you get this textbook, and how much does it cost?
You can get it on the Cenegenics online store. It's also on Amazon. If you simply Google my name, it should come up. The cost is $175 per volume.
Fantastic. So how long did it take for you to write it?
It took about 2 years to get everything down on paper. One of my former trainees, Dr. Todd Greenberg, approached me and said, I'd really like to help you write a textbook, and I'll help you get the ideas down on paper. And so it was a great collaboration, and something we're proud of, and hope that it contributes to the growth of the field and the education of future physicians.
So why don't you tell us a little, compare and contrast the other programs that are out there in terms of why your program is better than others?
Well, I think that there are various types of programs. Some of the training courses focus exclusively on managing the hormones. I think that we tend not to follow a template format. I talk a lot about the basic science. I think the conceptual models are very important that we get that right. My background as a biochemist certainly shines through. I often remark that the answers are always in the physiology, so we really talk from that point of view, and as I said, really try to set that foundation. I think that that's what makes us a distinction. Also, we're very literature-based. As I said, the textbook has over 3,600 literature citations, and I really try to speak from what's in the literature, explain that, because at the end of the day, we want to do good medicine based on solid research.
Well, this is great that you're pursuing a career that you love to do, and can you tell us again what the name of the program is?
The program is Physician Training in Age Management Medicine. It's put on by the Age Management Education Foundation, and more information can be found at the AMMG website, or they can simply give me a call or send me an email at jleake@cenegenics.com, and I'd be happy to give them more information.
Fantastic. Thank you.
Thank you, Ed.